Do you feel like you look older because you have deepening lines around your mouth? I'm Dr. Sarah Allen, Chief Medical Officer of SkinClick, and here are all of the ways that you can treat those deepening lines around your mouth. This is probably the number one complaint that patients come to me with, but the great news is we have so many techniques to address all of this, both surgical and non-surgical. As we get older, I always tell patients we suffer from the 3Ds: descent of your fat pads and your ligaments, so it feels like everything is melting; deflation of your fat pads, which can be depressing. First, it's important to understand why this is occurring. So, as we get older, we lose fat in some places in our face and it distributes to different places. Take, for instance, the jowl fat pad, which becomes larger as you get older, giving you the appearance of heavy jowling. But in the case of these lines around your mouth, which healthcare providers tend to refer as your nasolabial folds, these begin to develop because you have redistribution of fat pads and loss of other areas of fat. So you start to lose your lateral cheek fat and your temporal fat pad. You start to have enlargement of the nasolabial fold fat pad, loss of your deep medial cheek fat, which flattens out your cheek, and also loss of your medial cheek fat pad. Couple with that ligaments that used to be tight and now sag like a hammock, and you have quite a dilemma on your hands. And it's important to recognize what causes this because it does often change how we treat that area based on your anatomy. If you're a healthcare provider, stick around for my lineup at the end because I'm going to tell you all of the methods that you can use to appropriately correct this. For my patients out there, you have a few options. You can have hyaluronic acid fillers, and these fillers are dissolvable. One of the simplest ways to treat this is by treating an area called the piriform aperture. This is this small triangle just beside your nose and before you get to the fold. So right there. And we are able to go in with a hyaluronic acid filler and deliver just a small amount of filler in that area, and it allows this entire area to lift. I often tell patients that's my party trick. In experienced hands, it is quite safe, but you must have a healthcare provider who knows what they're doing because you have a lot of vascular structures in that area, particularly one large artery. It's important not to injure that artery at all, as it gives your face a lot of blood supply. This is why it's so important to have a highly trained and skilled provider performing these procedures. All right, so that's the first way. The second way is we can give you a medication called a biostimulator. So these are things like Sculptra, and Sculptra would be delivered much in the same way as I just talked about with the hyaluronic acid filler. What's the catch? Well, it's going to take you at least 4 weeks to see any results from this. Sculptra is a long-term investment, but it pays dividends in your collagen savings bank. And this is one of the best things that you can do for your skin long-term. What's the downside? If you have an autoimmune condition, you probably want to rethink getting Sculptra, particularly if it's active. And you have to be patient. So let's say you have a wedding coming up. I would recommend hyaluronic acid for immediate fix, right? But Sculptra can be your long-term investment. Okay, the third option is hyperdilute calcium hydroxyapatite, or Radius. And this is given in a completely different way than Sculptra. We typically use a cannula to deliver this medication, and we make a port site and we move our cannula all the way to the little triangle that I told you about before, and we deliver a little bit of product. Hyperdilute calcium hydroxyapatite is similar to Sculptra in that it does take 4 to 12 weeks for you to see long-term collagen stimulation from that product. Okay, but you're going to see immediate volume replacement with calcium hydroxyapatite. And so that's also a great option if you have an event coming up and you don't have enough time to wait for all of your collagen to pick up. Okay. The fourth way that you can do this is simply by filling the nasolabial fold line. Now, this fell out of favor a few years ago, but I would say is regaining popularity with facial balancing. It's a simple procedure. You do tend to bruise with this technique, so it's important that you take that into account for healing, but it can blunt the appearance of that nasolabial fold. It also can help strengthen the skin around that area and give you some benefits long term. The final way is occasionally a provider will use a cannula that I talked to you about earlier. And they will start at the beginning of the fold and attempt to fill the entire fold. This is really only necessary when you have very deep nasolabial folds. And so this is certainly not for everyone. I often tell my patients, if you come into me and you say, it is this portion of my face, these folds and these folds that I really don't like, I'm going to refer you for consultation for a facelift, particularly if you're 50 or older. And the reason is I like for you to have all of your options laid out before we make a treatment decision. And if you've ever considered surgery or would consider surgery, a lower facelift or a deep plane facelift is going to give you an appearance that we simply cannot achieve with filler. So if you ever come in and you say, I want to look like this, I'm going to talk to you about that. Now, don't get me wrong, there are certainly things that we can do with filler, and there are non surgical options, but I always like for you to have all the facts before you make any kind of long term treatment decision. If you're a patient and you found this helpful, like, subscribe, and share. Okay, so this portion is for my healthcare providers. So these are the ways that you can take care of the nasolabial folds. Number one, hyaluronic acid filler on periosteum, typically angling towards the contralateral corner of the mouth. That's number one. Number two, you can do a depot of Sculptra anywhere from zero point 0.8 to 1 cc. I typically don't go above 1 cc. And the reason is you do not want to overfill this area. Your patient can end up having the appearance of a monkey, and no one wants that. The third way, hyperdilute radius, typically at, I would say, a dilution of 1 to 1 or all the way up to 1 to 3. It depends on what your goals are for your patient. If you need a little bit more volume, 1 to 1, that has maximal collagen stimulation. If you want less volume and just a little bit of collagen stimulation, 1 to 3. You're going to make a cannula insertion site, which I typically use for resuscitation of the entire malar area. And then you can advance your cannula uh, just into the superficial piriform space. You're in layer 2 and deliver just a small amount there. It's a beautiful result for patients. Number 4, you can use hyaluronic acid filler all down the length of the nasolabial fold. It's a very superficial injection. You need a low to mid G prime dermal filler. And typically, you need to cover the entire area of the fold. So I'll often have providers have one central injection in the fold, one medial to that, one lateral to that. Number 5, and really only pertinent for very deep nasolabial folds, would be inserting a cannula in the inferior portion and tunneling all of the way up towards the piriform aperture and providing appropriate resuscitation down that nasolabial fold. Certainly, you can get fancy with your techniques. You may learn to cross hatch if you are doing superficial dermal filler in that nasolabial fold. As with anything, that's dependent on skill and certainly on the outcomes that you get.